So we take a quick question. A 39-year-old man is diagnosed with acromegaly due to pituitary macroadenoma. If IGF levels remain elevated after transsphenoidal surgery, what is the most appropriate next step in management? So it's still high. So as we mentioned in our last slide, the management slide of it, the first line therapy is transsphenoidal. If it's still high, you can do your radiotherapy, you can do medical therapy. So here, start bromocriptine is part of the medical therapy, like a second line medical therapy. That's right. Initiate somatostatin analog therapy. That's like a first line medical therapy. Perform repeat transsphenoidal. Usually, a repeat is not done. You have to do second line therapy. Begin dopamine agonist therapy alone. So the dopamine agonist therapy is the same as bromocriptine. That's an example. So these two, D and A, are essentially the same. So we are left with initiate somatostatin analog and perform repeat transsphenoidal. Perform repeat transsphenoidal is usually not done. So somatostatin analogs like octreotide and lanreotide is the gold standard medical therapy. So that's the answer. So initiate somatostatin analog therapy is the answer over here.